The Affordable Care Act has prompted debate over the need for government-directed health care. For decades, the government has run health care systems for military veterans and also Medicare and Medicaid. And the Indian Health Service provides care for thousands of tribal members in Oklahoma.
So she's 14 months, Mom?
Yes.
Charlie Kay has the sniffles and a cough. Her mom, Shelley Wani, traveled from Morris to Tahlequah so she could be seen by a doctor at the Cherokee Nation's Hastings Hospital.
Yeah, she sounds a little bit congested, Mom.
Charlie was born with Down syndrome, and we just loved her doctor. He took such great care of her, and that's why we continue to drive an hour and 15 minutes to come.
Wani's family falls into one of the big cracks in the traditional healthcare system.
We didn't have insurance.
Because her husband is a Creek tribal member, the family qualifies for Indian Health Services. Treaty obligations require the federal government to provide health care for Native Americans. Carmelita Wamigo Skeeter is CEO of Indian Healthcare Resource Center in Tulsa.
We serve Indian individuals no matter what their income is. They do not have to pay to come for these services.
Skeeter says half of Oklahoma's 39 federally recognized tribes operate healthcare clinics and hospitals. The Cherokee Nation runs the largest Native American healthcare system. Bill John Baker is principal chief.
If all we did was rely on what the federal government allowed for health care in Oklahoma, we wouldn't meet 40% of the need.
So Indian healthcare systems blend healthcare funding they get from the federal government with other resources to cover the cost of providing care. It works like this. If patients have medical insurance, Medicaid, or Medicare,
we do bill Medicaid, Medicare, and private insurance.
Baker says the Cherokee also put 5% of the profits from their casinos and tribal businesses toward health care.
We've had to be very proactive and put our money where our mouth is to not only collect insurance and private insurance and Medicare, Medicaid, all third-party pays, but we've actually put our money with it so that we can better serve our people.
Look at me. Real big. Say ah.
Many tribes and Indian healthcare providers also solicit grants and donations from foundations and corporations.
Your needs are so broad that no agency can meet all those needs. And I don't believe that our government would ever be able to meet all those needs. You have to have a blend. You have to have the private sector involved. And you have to have the corporations and the industry involved.
Well, I'm missing to you, sweetheart.
Blending resources allowed the Indian Healthcare Resource Center to grow from a single volunteer doctor a couple of decades ago to a sprawling clinic offering services ranging from OB and pediatric care.
Any new concerns? No.
To outpatient clinics for adults covering everything from regular checkups to diabetes management and mental health services.
The robot fills the bottles.
The center has a state-of-the-art pharmacy with automated dispensers capable of filling up to 1,000 prescriptions a day. There's also a full dental clinic. But Skeeter says this facility, as well as other Indian healthcare clinics, sometimes have difficulty providing patients with certain services.
I believe our biggest problem today is funding to see specialists. And that is the biggest expense because we can take care of the primary outpatient services here in the facility. But when we need a specialist or specialty care, then the funding for that care is very hard to come by, particularly if you don't have Medicaid or Medicare or private insurance.
Skeeter and Baker say tribal healthcare systems make every effort within their budgets to provide the most and best care possible. Indian health systems don't want to be regarded mostly as providers of last resort for indigent or uninsured Native Americans.
We've got to be the provider of choice so that our Cherokee citizens that have insurance, we've got to do a good enough job to attract them to come to our facility so that we can collect their insurance, so that we can help take care of the ones that have no insurance.
Connie Davis is Executive Director of Health Services for the Cherokee Nation. She says providing a high standard of care does more than attract patients that can pay part of the bill.
Something the public is beginning to hear right now is about reimbursement toward hospitals, value-based purchasing, and hospitals are paid based on how well they take care of cardiac patients, congestive heart failure patients, pneumonias, and many surgeries. And for years, the government has expected those kinds of performances from these tribal hospitals and facilities, and Cherokee Nation has exceeded those expectations across the nation and actually leads in the GEPRA scores for all other tribes.
GEPRA, or GPRA, stands for Government Performance Rating Act. Hastings' GEPRA score and high volume of patient visits are signs more and more Native Americans with insurance do select Indian healthcare systems as their provider of choice.
This facility here was built in the early 80s. It was designed for 30,000 patient visits, and we saw over 300,000 patients in this facility last year.
So planning is underway for a major expansion of the hospital. The Affordable Care Act will be fully implemented in 2014. The Indian healthcare system could provide a template for how healthcare will operate under the Act.
With more people with insurance, then less private hospitals, less city hospitals will be giving, not billing for services. And so I think they'll get more lean and mean, but at least if they get the basic care covered, it ought to be for better health care for everybody.
2 government health care systems are teaming up to give Native American veterans better access to health care. The Department of Veterans Affairs will now reimburse Indian Health Services for providing care for Native American veterans. The agreement between the VA and IHS aims to improve access to care for Native American veterans, especially those living in rural areas.